Chapter 8, A Wake-Up Call to the World. COVID-19 Pandemic 2020-2021. 7:30 a.m., December 30th, 2019. The sun was barely up, and Dr. Li Wenliang was already on his way to work in Wuhan, China. Patches of fog clung to the wide brown expanse of the Yangtze River, and he could just see the tips of the skyscrapers above the gray mist. In the parks along the river, people were gathering for their morning Tai Chi exercises. Dr. Li took deep breaths of the cold air as he strode by. Walking to his job at Wuhan Central Hospital helped him focus for the busy day ahead, and these riverside pathways were his favorite route. In the early mornings, they were a rare oasis of calm in this city of 11 million people. Wuhan is an important manufacturing center and transportation hub, so its streets are always crowded with cars, trucks, buses, and people. Just 33 years old, Li Wenliang was already one of the hospital's top ophthalmologists, or eye doctors. Dr. Li took his work treating diseases of the eyes very seriously, and he often came in early to spend time catching up with the latest medical research before seeing his first patient of the day. When Li found an interesting new study or report, he'd take a few minutes to share it with his friends from medical school. Even though they were now working at hospitals all across China, the group of more than 150 young doctors kept in touch almost daily over WeChat, the popular Chinese language social media network. Li enjoyed joining in the lively debates about new treatments and puzzling cases. As Li approached the hospital's parking lot, he saw it was already jammed with cars and ambulances. Inside, the emergency department's waiting room was overflowing, and the hallways were thronged with patients and white-coated hospital workers. As he threaded his way through the crowds to get to the elevators, Li watched the activity around him. For several days, he noticed that the hospital, always humming with energy and crowded with patients, had seemed even busier than usual. At the end of each shift, the doctors and nurses working in the emergency room staggered out, pale with exhaustion. And to Dr. Li, trained to look closely and pay attention to what he saw, they didn't just seem tired, they looked worried. A few floors up on the ophthalmology ward where Li worked, things were quieter. He stepped into his office to review the chart for his first patient of the day. But before he could sit down, his phone buzzed in his pocket. A new email. It was a message from the chief of the emergency room, Dr. A.I. Fenn. She had sent the email to several doctors throughout the hospital, and she had marked it urgent. The email described a patient she had treated a few days earlier. He had come to the emergency room complaining of a fever and trouble breathing. An x-ray showed that he had inflammation in his lungs, and she had diagnosed the man with pneumonia. But something didn't sit right with Dr. A.I. She hadn't yet been able to determine what was causing the man's pneumonia, and the patterns of symptoms reminded her of the patients she treated in 2003 who had a disease called severe acute respiratory syndrome, or SARS. What had her really worried, though, was what had been happening over the last 3 days. Since diagnosing that first patient, 6 more people had turned up in the hospital's emergency room with the same unusual symptoms, and in each case, the cause of the pneumonia was unknown. Whatever was causing the first patient's pneumonia, Dr. A.I. suspected it was spreading. Li Wenliang's first patient of the day arrived. The doctor slipped his phone back into his pocket and started to work, but he couldn't stop thinking about what he had just read. He had learned about SARS in medical school, how a respiratory illness caused by a never-before-seen virus had turned into a pandemic. It had started in China after a virus usually found only in small mammals mutated and began to infect humans. The disease spread quickly to cities across the globe, infecting more than 8,000 people and killing hundreds, all in the space of less than 6 months. Then, as quickly as it had emerged, SARS had disappeared again. Could the disease have come back? All day long, Li Wenliang asked himself how he could help fight the danger that had emerged in the emergency room just a few floors below. Was there anything he could do to prevent another epidemic from starting? As a doctor, he had a responsibility to do everything he could to protect people's health against disease.